Expanded Program on Immunization was established in 1976 to ensure that infants, children, and mothers have access to routinely recommended infant and childhood vaccines. 6 vaccine-preventable diseases were initially included in the API: tuberculosis, poliomyelitis, diphtheria, tetanus, pertussis, and measles. So, noong 2002, ang World Health Organization ay nagtala ng 1.4 million deaths sa mga batang may edad na 5 pababa dahil sa mga sakit na maaaring maiwasan kung mayroong bakuna ang mga bata. This represents 14% of the global total mortality in children under 5 years of age. So, vaccines included in the API. Dahil ang mga bata ay prone at very vulnerable pagdating sa mga sakit, ang mga sumusunod ay ang mga vaccine na kasama sa programang ito ng DOH. BCG para sa tuberculosis na dapat ibinibigay pagkapanganak. Sa mga bata, maaaring maapektuhan ng iba't ibang organ sa katawan kagaya ng utak at maaaring maging sanhi ng pagkamatay. Hep B vaccine para maiwasan ang liver infections na maaaring maging dahilan ng mas malalang liver problems paglaki ng bata. Binibigay rin ito pagkapanganak. Penta vaccine or DPT, binibigay ito para maiwasan ang diphtheria na ini-infect ang lalamunan at tonsils na nagdudulot ng hirap sa paghinga at paglunok. Pertussis o whooping cough na maaaring magdulot ng labis na pag-ubo at iba pang komplikasyon. Tetanus na nagiging sanhi ng lockjaw sa mga bata, ibinibigay ito kada 6th, 10th at 14th week pagkatapos ipanganak. OPV or oral polio vaccine, dahil walang gamot ang polio, ang tanging paraan para hindi magkaroon nito ay sa pamamagitan ng bakuna. Ayon sa tala ng DOH noong 2019, ay may 8 kaso ng polio sa bansa, ngunit ito ay mga isolated case lamang. Binibigay rin ito kada 6th, 10th at 14th week pagkatapos ipanganak. PCV or pneumococcal conjugate vaccine, ang mga pneumococcal diseases kagaya ng pneumonia at meningitis ay mga pangkaraniwang dahilan ng pagkamatay ng mga bata edad 2 pababa. MMR or measles, mumps, rubella vaccine, ang measles ay isang lubhang nakakahawang sakit. Isa sa mga sintomas nito ay rashes, lagnat, at mga puting spot sa bibig. Ang paglala nito ay maaaring magdulot ng pagkabulag, pamamaga ng utak at pagkamatay. Mumps o beke, ang komplikasyon na hatid nito ay pamamaga ng bayag, meningitis at pagkabingi. Masasabi na ang bata ay fully vaccinated kung siya ay may 1 dose ng BCG at HEPA pagkapanganak, 3 dose ng Penta at OPV, 1 dose ng measles vaccine bago ang kanyang first birthday. So, specific goals na expanded program on immunization is to immunize all infants and children against the most common vaccine-preventable diseases, to sustain the polio-free status of the Philippines, to eliminate the measles infection, to eliminate maternal and neonatal tetanus, to control diphtheria, pertussis, hepatitis B, and German measles, and to prevent the extrapulmonary tuberculosis among children. So, ang original na overall objective nila ay mabawasan ang kaso ng pagkamatay ng dahil sa mga sakit na maaaring maiwasan sa pamamagitan ng pagbabakuna.
How will expanded program on immunization affects the community? So when we say community, it is a group of people in a place with shared or common interests. So we share beliefs, culture, and practices, and the community is comprised or influenced by social, economics, and health. So the EPI affect the community through health. Reduction in infectious diseases, morbidity, and mortality. So of course, diba ito nga ang highlight ng EPI, in-implement siya para masigurado na mababakunahan lahat ng vulnerable age groups bago pa sila magkaroon ng contact sa infectious diseases. So this helped a lot para mabawasan yung number of people or population na nagkakaroon ng sakit and eventually nagiging dahilan ng pagkamatay nila. And it also protects future generation by eradicating the diseases. Okay, next. So the EPI or the Expanded Program on Immunization affect the community through its social aspect. First, equity of healthcare. So dahil nga mayroong barrier between the privileged and the underprivileged society, so yung mga nakaka-experience ng poverty, parang mas may mga risk or mas prone sila sa sakit. But EPI helps people to access safe vaccines na. EPI ang nag-act as a starting point para mabawasan yung impact ng infectious diseases sa mga tao, especially sa mga bata. So dahil dito mas nag-focus yung healthcare system sa mga vulnerable people in our community through making policy decisions, therefore promoting equity of healthcare. Okay, second, empowerment of women. So sinasabi na women have their role in the health-related decision for their children. They are responsible sa immunization ng mga bata. So as much as their kids, their health is also important. API affects women in the community by reducing maternal and young child health inequalities. So, through equal access in health resources, saka isa pa, maternal vaccination open the way para maiwasan na magkasakit yung mga infants and neonatal natin to be vaccinated against pertussis, influenza, and tetanus. So, EPI large affected the women in our community. Okay, so the third one is impact of life expectancy and opportunity. So in this, it means that yung mga recipients ng EPI, may mga potential sila for improved life expectancy kasi nga nagkaroon sila ng opportunity because of the said program. So EPI provides a degree of social mobility and an opportunity to move things that they desire of. Infant and children then will survive a healthy lives and be productive. Okay, and then lastly, strengthen health and social care infrastructure. So, para may provide yung EPI sa mga infants and children, of course, kailangan ng certain degree of healthcare infrastructure. Kailangan din ng proper storage ng vaccines, appropriate staff, transportation, and aftercare. So, this infrastructures provides the basis sa mga provision ng iba't ibang health and social care services ng lahat ng member ng community. Particularly yung mga para ma-improve yung maternal and infant mortality. So, yung mga public health infrastructures also help para ma-disseminate yung mga information and promote health education regarding hygiene and sanitation. Next, so the expanded program on immunization affect the community also in terms of its economy. So, first, cost savings. So, API is cost-effective kumpara sa ibang health interventions, especially yung vaccines for kids. EPI is also a written vaccines kung saan pinaprovide ng government for free sa mga public health centers and facilities para ma-improve yung health ng mga tao. So dahil dito, it becomes a way for economical growth kasi less money is spent sa mga medical tests, procedures, and treatments kasi nga may mga protection na ang mga tao. Okay, so second, increase productivity. So sabi nga natin kanina, less money is spent sa EPI kaya it promotes economic growth. And economic growth improve health kasi nga mas nakakapag-invest yung mga professionals or yung healthcare system natin sa other aspects of health like yung mga antibiotics and clean water. So dahil dito nagkakaroon ng lugar where people are safe to live in. Yung mga batang nabakunahan and healthy according to research, mas nag-improve yung performance nila sa school. So this also happens sa mga family. Mas nabigyan sila ng opportunity to be productive through education and work and mag-invest sa mga bagay for their future. Okay, so the third one, minimizing the impact on family. EPI protects us from the harmful impact po of illness which may decreases our productivity. Kaya itong EPI napaka-importante na maka-avail ang isang pamilya dahil sobrang lawak and sobrang tagal na epekto nito sa tao in all aspect of life. Okay, and then lastly, cost-effective preparedness for outbreaks. So habang lumalaki yung population natin, so a lot of interactions also has to be made or happen. So hindi may iwasan na mag-rise ang potential infectious diseases. So, gaya na lang ngayon yung COVID-19. So, kaya the community is protected by investing sa healthcare system that could identify and effectively control measures to limit the spread of a disease. Okay, so how can the community participate in the said program? First, make demands on the health system. So, dapat clear ang demand sa EPI together with financial and human resources para maiplano ng maayos ang pag-deliver ng service. Dapat may strong demand ang community for immunization para masigurado na makakakuha talaga lahat ng tao ng vaccine. Way of making demands is to communicate like engaging mobile phone companies na tumulong na ma-spread ang information regarding vaccines. Next, the second one, participate in the planning and implementation of programs within their communities. So, dapat maging engaged ang isang community or isang individual sa planning, implementation, and monitoring ng immunization service, delivery ng sa gayon ay magkaroon ng power ang mga tao na mag-demand ng accountability. So mahalaga po na alam ng mga tao ang kanilang mga karapatan at responsibilidad na mapanatili yung service delivery ng pagbakuna. Okay, so next, increase awareness about the risk of vaccine-preventable diseases. So marami ng mga tao na vaccine hesitancy ngayon or ayaw na magpa-vaccine, and this is influenced by their practices and religious beliefs. So tama naman na magkaroon tayo ng doubt sa vaccines. So, dapat maging aware tayo or magkaroon tayo ng initiative to know more about the vaccine. Nang sa gayon, para pag nalaman natin kung ano talaga yung totoo about the vaccine, ma-encourage din natin yung ibang tao regarding doon and ma-influensyahan natin sila para mag-engage into vaccine. Okay, so next, enhance trust in vaccines and immunization. Of course, you will not engage in API if you do not trust vaccines and immunization. So mahalaga na magkaroon tayo ng tiwala sa vaccines and immunization because it's a science kung saan scientific method ang ginamit in producing vaccines. So sabi ko nga kanina, increase your awareness about the vaccine-preventable diseases. So there may be a doubt, but it is important to try to understand that our health workers are the root of it and they do their best to give us a health service. So as much as they do their best, so we should too. Okay, and then lastly, Republic Act number 10152, Mandatory Infants and Children Health Immunization Act. So, dito sinasabi sa Republic Act 10152 na mandatory or obligadong pabakunahan ang mga batang kasama sa EPI. Ito ay isinabatas upang mas mahikayat at magtiwala ang mga magulang na pabakunahan ang kanilang mga anak. So, dapat alam natin to, yung mga information regarding this Republic Act.